dedicated funds into Minnesota's bridges, roads, and transit system. At the time of passage, the legislation was a groundbreaking investment in multimodal transportation and transit system in Minnesota and nationally. Anderson Kelleher grew up on a family farm near Mankato, Minnesota. She graduated from Harvard's Kennedy School of Government with a master's in public affairs mid-career and from Gustavus Adolphus College with a bachelor's in political science. She is married with 2 young adult children and lives in Minneapolis. Commissioner, thank you for joining us today. The floor is yours.
Well, good afternoon, everyone. I hope that the sound is working well. I'm going to look to Brian to give me a nod or a thumbs up, and he just went off the screen. Okay, great. I'll keep it brief. I want to first of all thank you for all of your work on this most important topic, the topic of towards zero deaths, and the work to make sure that all of our road users, no matter what form of transportation they are taking, that they are safe in our road system. And so I know today's topic is really about that systems approach and how to integrate a number of different areas together. This is your professional work, and like I said, it could not be more important. One of the most heartbreaking things as commissioner is to see those notices that come far too often about the crashes that have happened out there on the system, whether they are a vehicle crash or a crash that has involved a pedestrian or a bicyclist. It really is one of those things that I take to heart, that we need to do better. And particularly this year, we have seen in Minnesota a real spike in our deaths on the road system. And I think that COVID is affecting how we are moving forward as users of the transportation system, whether that be that we have more walkers out there and bikers, bicyclists, people using their bicycles for longer trips, or if it's that people are feeling the openness of our roadways when traffic was down. We need to do better here. This is something that we can all work together on. And I really appreciate the professionalism of all of you coming together in this way to, interdisciplinary work to cut down on the number of deaths that are happening to zero, because any death is unacceptable on the system. So thank you so much. I appreciate you being here and I wish you well. I know that you're partway through the series and I look forward to listening in for a while today. Thanks so much, Brian.
Thank you, Commissioner. We appreciate your commitment to traffic safety in Minnesota and look forward to working with you in the coming years to reduce life-changing crashes through TZD. Now, before we start the official webinar topic, the TZD program is excited to recognize a TZD Award recipient. Today, we are recognizing the 2020 TZD Engineering Star Award winner, Lauren Hill. Lauren, who is currently a principal engineer with the Minnesota Department of Transportation, has long been a familiar face to Minnesota's traffic safety experts through his work at both MnDOT and the Minnesota Department of Public Safety. He's been involved with TZD since its inception in 2003, when he was the state traffic safety engineer. Lauren has been instrumental in helping to modernize crash data inputs, particularly in leading the development of the new MN-CMAT2 crash data program, which went live in March of this year. This program is the culmination of years of effort building on previous successes, including the MN crash data system. Lauren collaborated with engineers across the state to develop, test, and implement beta versions of the MN-CMAT2 system, which delivers data and insights on individual crash circumstances. This in turn helps engineers and law enforcement evaluate crash histories for specific locations or system-wide, ensuring that road improvements are deployed and effective. So congratulations, Lauren. Would you like to say a few words?
Yes. I'm deeply honored. I'm humbled for those who nominated me and indeed selected me for this. There's a lot more deserving folks out there too. I just want to quickly thank some folks. Mark Viziski certainly for hiring me and creating a great team, of which Germa, Lowell, and Camario were instrumental. And Mark also hired just a contractor, Great Arc Technologies. They're rock stars. The folks that develop it, they're absolute rock stars. So thank you. Also, the county and city engineers, especially the safety committees, those folks are just tremendous advocates for traffic safety. I want to thank the MnDOT Office of Traffic Engineering, even Nathan, and the district traffic engineers, the Department of Public Safety, both the Office of Traffic Safety and State Patrol. And then I want to say a special thank you to law enforcement. Particularly, I'll mention the law enforcement liaisons, Bill, Becky, Frank, and Scott. But without you folks giving us dots, crash reports, we wouldn't have dots in CMAT. I also thank you for all the TZD activities you do. But I especially at 30,000 feet, I just want to thank you in this defunding police atmosphere and stuff. You guys are heroes to us, and thank you for protecting all of us daily. And with that, I'm done. Thank you, Brian.
Thanks, Lauren. Congratulations again on a very well-earned award. So for those of you joining us late, welcome again to today's webinar, Safe Systems, a human-centered approach to traffic safety. Before I introduce our speakers for the day, we have a few housekeeping items I want to cover. This webinar will be recorded, is being recorded as we speak, and a link to the recording will be available on the TZD website shortly after the webinar is over. If you have a question for our speaker, please put it in the Q&A box at the bottom of your screen. Note that's different from the chat box. Use Q&A. You can also ask for technical help through the Q&A box. We plan to address questions at the conclusion of all three presentations. If there is a question that needs immediate attention, I can interject if we need to. The TZD webinar series is proud to offer continuing education credits as well. So both PDHs and post credits are available. You can find the forms for these credits on the webpage for this session at the minnesotatzd.org website. And for our law enforcement viewers, as I mentioned, post credits are available for the webinar. Please read this important announcement from the post board. If you are watching this webinar live, just simply watch the webinar in its entirety and TZD will submit the affidavit of attendance report to the post board for you. If you are watching a recorded version of this webinar, please complete the affidavit of attendance on the TZD website and email it to tzd@umn.edu. Instructions are on the website if you need more details with that. So now on to our topic for today, Safe Systems, a human-centered approach to traffic safety. We have three speakers with us today to help us better understand safe systems. Our first speaker is Wes Comfort. Wes is an engineering research associate with the Highway Safety Research Center, known as HSRC, at the University of North Carolina. He joined HSRC in 2017 as a postdoctoral research associate with a focus on crash analysis and safety education. His primary research interest is traffic safety management through a system-oriented approach. While at HSRC, Wes has worked on pedestrian crash modeling, safe systems implementation, and engineering evaluation. He uses this experience as a member of the Road to Zero Safe System and Traffic Safety Culture working groups, and as the research manager of the Collaborative Sciences Center for Road Safety. Prior to joining HSRC, he worked as a postdoctoral research associate associate and course instructor at Texas Tech University as part of the Center for Multidisciplinary Research in Transportation. Wes has received his doctorate in civil engineering at Texas Tech University and was active in their teaching, learning, and professional development center as a fellow, consultant, and workshop facilitator. In his free time, Wes enjoys hiking with his wife and dog. With that, I will turn it over to Wes.
Thank you so much, Brian, and thank you everyone for coming and attending this webinar. I would have loved to have given this presentation in person, but things being what they are, I do appreciate everyone who is making time to log into these things. So as Brian mentioned, I'm going to be talking about safe systems, and in fact, I'm going to be talking about rethinking traffic safety management in the United States from a safe systems perspective. So usually when I talk about safe systems, I like to try to cover a bit of common questions, some guiding questions that can help us orient and understand this particular paradigm. These guiding questions are: what is a safe system? Why do we need it? How is it different? And what does safe systems look like in the United States? And I'm hoping that this introduction will provide a good segue to the other two speakers today, as I'll be kind of setting the ground floor for them to talk about what is actually happening at the state level and then some of the lessons learned internationally. So let's start with this first question of what is a safe system? Well, safe systems is a traffic safety management paradigm that we have adopted from different countries around the world. It has a few different names. The Netherlands calls it sustainable safety. Sweden has their Vision Zero, and both Australia, and I didn't include them here, but New Zealand have their own safe systems approaches. And each of these varies a little bit from the other, and especially in the way that they were implemented, whether it was top down from the government or more of a grassroots type function, and what some of the motivations are, but they do tend to have several things in common. And to that point, you've probably seen some sort of logo like this if you've ever looked at any safe systems literature. The idea behind this is that a safe system centers zero death and injury. That is the goal. And then around that system is this idea that if we can simply improve roadways, vehicles, speeds, and road users, that we could then achieve that goal. And while I think zero death and injury is the goal that we need to be working toward, the rest of this figure can be a little bit hard to understand as far as, well, how do we actually fix these things? How do we protect road users? How do we improve our roadways? And that's what I'm going to try to address today, and what I'm hoping the other speakers will also work toward addressing. So I am, as mentioned in the introduction, part of the Collaborative Sciences Center for Road Safety, and we are a UTC that is focusing on safe systems and system science. And so whenever we talk about safe systems, we talk about four key principles, namely adapting the structure and function of the transportation system to the complexities of human behavior, managing the kinetic energy transferred among road users, treating road user safety as the foundation of all system interventions, and fostering the creation of a shared vision and coordinated action. So now that we sort of understand the principles behind safe systems and how it got to the US from somewhat things that other countries are doing, I think it would be important to once again affirm why we need to do this. Why do we need a different paradigm in the United States? And I think if we were to look at our fatal crash trends and fatalities from 1975 to 2018, and some other statistics I'm about to show you, I think you'll see that we have made some advances, but we're not where we should be. In fact, within recent years, we have plateaued in the number of fatalities, whereas before it had been driving down. And some of this question is, well, is the change that we saw previously around the economic downturn and in the early 2010s, was that entirely due to changes in travel patterns? And if so, are we actually improving things, or is that simply a matter of the denominator? Meaning if we're talking about the deaths per vehicle miles of travel, if you take away that vehicle miles of travel or reduce it, then you might be changing what you're looking at. And so this is a good question of how much are we actually improving? And so I want to look at a few other things. This ITF report just came out, and it compares percent change in road deaths over the last 9 years. And then it talks about road fatalities per 100,000 inhabitants in 2019. And compared to a lot of the other industrialized nations in the world, the United States is not doing as well. We have had quite an increase in fatalities over that time. I just showed you that trend that showed that there was a bump up around 2015 and 2017. But our percent change has actually been on the positive side instead of the negative side where we would like it to be. And then if we look at the road fatalities per 100,000, we rank toward the bottom of this list. Part of the reason why this might be the case is, at least if we look at how the World Health Organization compares speed limit laws and good speed laws, we don't have good speed laws here in the United States. I would go so far as to say that we have a speed problem in the United States. There is a lot of speeding. We have very high speed limits, and this results in high kinetic energy on our roadway network. And kinetic energy is extremely important to account for in a safe system because humans have a physiological threshold for kinetic energy. If we are really trying to focus on keeping humans at the center of our transportation system, then this is the thing that we really need to account for. So you've probably seen some version of this image before. This is looking at the percent likelihood of a fatal or serious injury occurring as the delta V, meaning the speed differential between colliding vehicles, increases. We see that that probability goes up. And that's not a linear relationship, that is an exponential relationship, meaning that as speed increases, our likelihood of a death or serious injury increases exponentially. I think Blair will probably talk a bit more about this figure, but one way that we can mitigate the kinetic energy is through changing the angle of crashes as they occur on the roadway. But what this does say is that a lot of the ways our transportation system is designed that brings people into conflict either head on or at 90-degree angles or some of these other severe angles can actually result in some pretty severe collisions and combinations. I also want to point out that if we're trying to keep human physiology at the center, then we need to also really bear in mind that pedestrians and bicyclists have no protection from the kinetic energy. They are not shelled in a steel cage that will diminish these crash forces. And so you've probably seen an S-curve like this that shows that a pedestrian's chance of fatal or severe injury and how it increases over speed limit gains. And really we see even getting past about 30 miles per hour, we're getting into like the 40, almost 50% chance of a fatal or serious injury. It is serious, the effect of speed on those who are more exposed to crash forces. And various other studies have shown these same kinds of relationships. These are just some tables synthesized from different references, but we see for pedestrians that if we're only talking about fatality and not necessarily serious injuries, that when we get into the 30 mile per hour range, we're looking at a 25% increase in risk. For bicyclists, if you get up to 30, you've almost doubled your risk for a fatal crash. And we even see that as your speed increases, it's especially dangerous for older pedestrians. Their risk of fatality also increases. So all of that taken into consideration, I think we have issues with speed in this country, and we have many road users who are very vulnerable to those high speeds. And so that's why in a safe system, we need to consider that human physiology, and we need to consider the way that we manage kinetic energy, and we need to do this in a collaborative way. So I'm going to move on now to our next question, and that is, how is a safe system different? Especially if we're talking about human-centered design and some of the different ways that we might try to improve safety. Some of you may be asking, well, isn't this just what we've always done? So I'm going to reference Peter Norton. He did some work in 2015 highlighting the different paradigms of road safety. So whenever automobiles were first introduced in the United States back in the early 1900s, because they were still a novelty and it was new technology and a lot of road laws were still being adapted, the onus was put on drivers to bear the responsibility for their own safety and the safety of others. As we moved into the 20s to 60s, when more people were buying vehicles and vehicles were becoming ubiquitous, professionals realized that there needed to be a little bit more of a multidisciplinary approach to improving safety. And this is the genesis of the 3 E's. And I understand that a lot of the representatives and folks who are calling in today on this webinar are probably one of these 3 E's. You're either an engineer, you're involved in public health or education, or you're involved in law enforcement. And you might also be with emergency medical services or any of the other E's that you sometimes see combined here. But this was an attempt to have a multidisciplinary approach to safety. We then made pretty substantial gains in improving safety in the 60s to 80s through crashworthiness because vehicles became much safer. Vehicles now had airbags, and they had improved crumple zones, they had seat belts, things that would just keep their occupants safe. And that moves us into the traffic safety paradigm that we're in today that we might call responsibility. And this is something of a return to what it first was, being drivers are responsible for their own safety and the safety of others. We still have the E's, we're still trying to approach it from that way. But I think a lot of us are taking a look at the system and recognizing that we need to move a bit beyond the E's. And so this is where Safe Systems comes in. It is a transition from what we might call this traditional approach of driver responsibility, where we might have very linear thinking in how we solve problems, such as, well, I'm going to design a road to meet a certain functional classification. I'm going to pick a design speed that fits that functional class, and then we're going to post speed limits below it and try to enforce those speed limits to make sure that people are safe. Whereas a safe system, we might try to, instead when we're doing our design or approaching these issues, we might try to anticipate human error, and we might try to accommodate human injury tolerance. Let me illustrate what I'm talking about as far as a systems approach with a diagram of linear thinking. So let's say that we recognize that a lot of drivers are driving under the influence. These drivers may then be causing crashes, which increases fatalities, and the fatalities then encourage policy actions such as increased enforcement. So the thinking is that if we can just keep enforcing, we can drive down that number of drivers under the influence, which can then affect crashes. But unfortunately, if you look at statistics of, say, drunk driving, for example, there actually hasn't been a lot of gain in this field for a very, very long time across the United States. Some of the changes that have occurred with these trends have actually just been due to older generations aging out of the prime drinking and driving demographic. And so we are not seeing a lot of solutions by this linear thinking. So in a safe system, what we might try to do is come at this problem from multiple approaches by doing things like separating users in space and separating users in time. This could be, when we say separating users in space, we're talking about providing facilities for people to be separated from that dangerous kinetic energy. So this means giving better sidewalks and crosswalks and control to pedestrians and bike lanes or shared use paths for bicyclists. It also means making sure that people are separated in time by doing things like LPIs at traffic lights, or even considering approaches like how can we motivate more people to use rideshare or transit, especially if they're going to be drinking and potentially using the roadway. We can also try to accommodate human injury tolerance by reducing speeds. So mitigating those places where people might be encouraged to speed and cause safety issues by doing things like physical roadway designs, traffic calming treatments, minimizing high-speed flows, and we can even enforce speed limits through things like automated speed enforcement. I know that a lot of jurisdictions in the United States, automated speed enforcement is not legal, but at least in Europe and several European countries, they have found ways to automate the process that is often fair and politically viable, and it removes the need for law enforcement to expend a lot of resources on enforcement of speed that can then be applied to other issues. We could also try to reduce our impact forces through designing safer intersections and improving our roadside clearance. So again, to revisit this problem of drinking and driving, there are a lot of different ways that we can approach this. And one thing is to recognize that some of the issues that we're trying to tackle through the E's are born out of off-system problems. And by that I mean, take drugs driving, for example. Maybe the reason people are becoming inhibited with drugs and then getting behind the wheel is because of economic issues, because of health issues, because of the medical field that maybe is writing prescriptions for too many drugs or too strong of drugs. Maybe there isn't good rehabilitation clinics to help addicts get off of drugs before they're getting behind the wheel. Maybe there isn't an administrative program that is, establishing interlocks if we're talking about alcohol. These are off-system issues that still affect traffic safety, and that's why we still need all of the E's represented, but we need to think about how these different factors come together. So to give you just a few more examples that can help differentiate from the traditional approach to safe systems, in a safe system, rather than minimizing delay and maximizing capacity, we might approach roadway design and retrofitting by managing kinetic energy and prioritizing modal affordance. One way to mitigate a lot of dangerous vehicles on the road is by to have more people walking and biking and just alleviating that burden on the road. We might approach countermeasures proactively through systemic risk analysis rather than reactively. And we might try to match the functional design and use of a roadway to its purpose so that we can then have self-explaining roads where people will naturally drive at lower speeds rather than setting very high speed limits and then just hoping that enforcement of the speed limits will be enough to fix the problem. And I do want to say that many people in the US are already doing these things. I don't think these are necessarily brand new and foreign ideas to the United States. And in fact, I'm hoping that John will talk about some of the things that he is seeing, and Blair will share some of the lessons learned from overseas on this. So some different examples of what does safe systems look like in the United States. If we are talking about all stakeholders prioritizing modal choice and managing kinetic energy, we're seeing things like small towns being revitalized by improving their walking and biking facilities. They become destinations where people can actually live active and healthy lifestyles, and it removes vehicles from the road and thereby decreases some of that risk. We see things like DOTs implementing safe roundabouts on rural areas. And roundabouts are wonderful because they manage speed and they change the angle of collision so your kinetic energy is reduced. We also see things like gateway treatments and speed enforcement, designs to limit speed entering into towns. So this image that I have here on the right of showing this kind of gateway treatment, not only will this help deter some head-on collisions, but it also creates visual friction that then can encourage drivers to naturally slow down. Excuse me. We also see a lot of implementation of complete streets policies, where now we're trying to marry our access to our roadway design and actually improve people's walkability and bikeability and thereby increase safety. If you provide good facilities for people to get around other than in car, we can actually limit some of the risks that come from a heavily motorized system. And one thing I've been seeing here in North Carolina quite a bit is law enforcement actually leveraging their substantial knowledge on traffic safety issues, because just as Lauren pointed out earlier, your law enforcement officers are the ones who are responding to crashes, and they're writing those reports and they are observing behaviors. So one way that we might be able to continue to leverage the relationship between law enforcement and engineers is to actually tap into that behavioral understanding and use law enforcement to say, hey, we've seen a lot of safety problems at this particular intersection or at this location. We've seen a lot of speeding. We've seen a lot of rear end collisions here. Why don't you treat that, Public Works? Why don't you use the city funds to instead of just continuing to write tickets to implement some sort of design that will mitigate those behaviors? And that can then cause the traveling public to respond to that change. And then we can attribute those law enforcement resources elsewhere. And then I also wanted to point out that a recent guide came from NACTO in their city limits guide that recognized that when we have high conflict potential and high density, we need very low speed limits to manage that kinetic energy. A safe systems in the United States might also look like a breakdown of silos. So I, as Brian pointed out, have been involved in the Road to Zero Coalition. We recently launched a new working group related to equity in transportation, where we are tackling some of the big issues and kind of legacy issues. But there are many, many people involved in the Road to Zero Coalition, from government to insurance groups, who are trying to tackle this problem. We also see a number of cities joining into the Vision Zero network and putting plans out there for achieving zero death and injury, and really working towards that from an administrative level. And I did want to even point out, I was poking around on the Minnesota TZD website and was just impressed by the sheer number of projects happening here from a multidisciplinary perspective. So I think these silos are being broken down. So just some key points I want to revisit is that safe systems is a human-centered traffic safety management paradigm, and we need to anticipate human error and accommodate human injury tolerance. I think a lot of places are doing safe systems practices, but some of our practices will require rethinking. Speed management is a great example of how to pursue a shared responsibility. And Vision Zero and Towards Zero Deaths are two sort of functional administrative frameworks for achieving safe systems. And I last just want to point out something I've been trying to point out quite a bit lately, and that is that you cannot have a safe system if you do not provide safe mobility for the most vulnerable, meaning pedestrians, bicyclists, and motorcyclists. So with that, Brian, I think we'll hand it over to the next speaker.
Great, thank you, Wes. So if you do have questions, just a reminder, you can type them in the Q&A box and we will answer them we'll have some time here at the end after all three presenters have gone through their presentations. There was a question about whether the slides will be made available, and I believe we have the okay from all three speakers to post them. So we will be posting the slides on the website after the presentation. So our second speaker today is John Milton. And John is the state safety engineer at the Washington State Department of Transportation. John has over 31 years of experience in highway safety and transportation engineering, and has worked in planning, programming design, and traffic operations. He received his PhD from the University of Washington, specializing in road safety. He is responsible for oversight of the statewide programs for Washington State DOT and safety, strategic performance, knowledge, enterprise risk, and research management. He currently leads the highway safety executives in a multidisciplinary and cross-functional manner to achieve Washington's zero fatal and serious injury crash goals. He is the chair of the World Road Association Technical Committee on Road Safety, chair of the Transportation Research Board Safety Section, and vice chair for the AASHTO Committee on Safety. With that, I will turn it over to John.
Well, thank you very much. And I hope that you can see my screen. I believe it's up.
We can.
All right. Well, thank you very much.
Hold on.
I'm going to provide a perspective really from the state side of things and how Washington State is carrying out safe systems, but really
John,
yes.
We are still seeing Wes's presentation.
Okay. And are you seeing mine now?
So John, if you just want to go down to the share screen area and just click start your share. And then from there, select your presentation. If you need help, I will share it for you.
And can you see it now?
Fortunately not. So I can just jump in and share my screen and we can operate that way. If that works for you, you just have to let me know to advance your slides for you.
So my apologies. I am not sure what was happening. It was showing that it was showing up on my screen here.
Okay, if you want
All
to,
right. So sorry about the difficulties. That's not unusual for me in electronic systems. So apologies again for that issue. Um, Let me talk about safe system from the implementation side of what a state DOT and at least what Washington State is going through. I think it's very important to kind of give that perspective as we work through the issue of safe system and its implementation in the United States. Next slide. So for me, it was a very personal experience that I dealt with. You know, we've seen this in Towards Zero and Target Zero in our state. The idea that what we do in terms of safety is vitally important, that no deaths are acceptable. We use this family type of discussion to highlight that. But for me, one day I was driving down the road and essentially vehicles in front of me, vehicles behind me essentially were in a crash. And really what happened is the vehicle went through the median, a young child was thrown from the vehicle and the car went across and was hit by a transit vehicle. And what made an impact on me that day was understanding that crashes occur and crashes occur for different reasons, whether they be human based, whether they be the road based. We can do something about those crashes. And for this particular case, we went out afterward and installed cable median barrier, a very important issue for us in Washington State. Next slide. Now, I want to talk about our journey and what we've done to put the pieces together. Next slide. So in Washington, our journey really starts with learning from others. And as Wes had suggested, sustainable safety and Vision Zeros were really a starter for the idea of safe systems internationally. Safe systems in about 2008 really became kind of a practice in moving towards as part of the work that was occurring at the international level, and then was really taken on by Australia as one of the primary countries carrying out this. The bottom line is that we all should be working from others, learning what they've done, how they've done it, how they carry out things. Washington learns from Minnesota and the great practices that you all have. And I might suggest that you're further along probably in this journey than you realize. Next slide. For us, it started in 2000. We were the first state to essentially work a Target Zero or Vision Zero type of plan. Our idea was really to model after what Sweden had done with their Vision Zero, but it serves as a premise. In Washington State, we essentially use that plan as a premise for how we develop and what we implement in the state. So it's a key focus area in a safe system to have an idea, to have a plan of approach, what you're doing and how you're going to be carrying out your safety programs in the future. Next slide. Now, Washington State began its whole thought process evolution from all the way back in the 1990s. We moved from a 3R sort of approach to more of a design focused approach where we looked at what was the contributing factors, the need for a project. To today, what we're doing more and more of is a performance-based sort of design. So I'm giving you an idea essentially of how we've evolved. We're a state that's willing to kind of take those steps and take risk in how we're doing things to try to learn, to try to grow. And that's just what we're seeing nationally as well. We're seeing more and more performance-based design, in part because we're having difficulties with asset management, maintaining what we have out in the roads as we have today. Our systemic treatment. So one thing that you heard from us was a very strong idea that we need to move to a proactive sort of approach. If you think about it, a reactive crash reduction sort of approach really is focusing on those crashes that already occurred. So if they're serious and fatal injuries, it's too late. You really have got to move your thinking into the proactive sense. And so our program is becoming more and more aligned that way. Next slide. So in 2019, we added safe system and equity as part of our plan, our strategic highway safety plan. And what we focused on in that discussion, and it was interesting as we work with our partners. So in Washington State, we have a traffic safety commission that brings all the different coalitions, as well as other state agencies, Department of Health, the State Patrol, together to have these big discussions. And what we learned from those discussions is that we could do something together. The idea that humans are fragile, we talk about that. And when you think about that in terms of what that means from implementation, there are products, there are different things that you can do to the roadside, to the intersections that will help alleviate that. We also looked at an adaptation of the hierarchy of control for safety, and I'll talk about that in just a little bit, and try to highlight how we're thinking about it in Washington, philosophically at least. And then also the need for multidisciplinary collaboration in the idea that users also need to be responsible. So there's a lot of discussion about blame versus responsibility, and I'll carry on with that in just a moment. Next slide. So this is a hierarchy of control. As Wes was pointing out, elimination essentially is the best way and most effective way for us to remove the potential for a crash. So removing people from a system or removing an issue to eliminate exposure before the crash occurs is the most effective. There are substitutions. We can do things out on the road surface should somebody get in a crash, a forgiving roadside, a forgiving intersection that really helps us to come up with a strategy that might lower injury severity or something to that effect. How we design is also important. So as we began our journey, it was a lot about how do we plan for projects? How do we design projects? How do we operate them? What needs to change within those systems to make us most effective? The administrative controls, the idea that laws and what we can do in terms of legislation and setting policies is less effective, but has some impact. And at the end, this was a really interesting discussion about personal protective equipment and what it can do. Now, there's no doubt that it is something that will reduce injuries. The question often is it the first approach? Now, in the blame culture, we hear a lot when we talk to or see in the media, for instance, that personal protective equipment wasn't, a helmet wasn't worn, clothes were dark. That's not where we should go with this in terms of if we're trying to reduce fatal and serious crashes. We need to eliminate the potential for it, not rely on personal protective equipment to do the job for us. Next slide. Next slide. So it was a cultural shift for us as well. Many of you have seen the chart on the left-hand side, and I get a little concerned about how this is actually carried out in terms of what it means. It says here that about 93%, 95%, I've heard in different, is related to the human. The fact that there are errors that are created or behaviors that occur that are related to the human, the driver, the issue, doesn't mean that we should walk away from that as a responsibility for us as infrastructure owners to do something about it. We need to think not in terms of we should not have to do this sort of project because there was so much drinking and driving or because there was so much running off the road due to speed. Rather, we should think, what is it that we can do from an infrastructure side to address those issues? We do it all the time. We don't think about it, right? Why do we put median barrier out? Why do we put edge line striping, rumble strips, or why do we put out roadside barriers? It's to reduce the fatalities and serious injuries that we see independent of the reason that somebody might run off the road. That's the idea of a forgiving infrastructure. Now, I hope in the future that as we talk about this slide on the left-hand side, the driver issues, that we think about it, we don't want to blame, but we do need the road users to share the responsibility for safety, to understand what they do in terms of the impacts, to understand how they are seen or not seen on the road surface, and to accommodate for that. Next slide. We went through a whole large discussion in terms of WASDOT improving its practices to move to the safe system. Quantifying safety performance is incredibly important for us to be able to really target those fatal and serious crashes and to expend our money in the most effective way. And to do that, you have to evaluate and analyze and diagnose the issues that you're seeing. It can't be all or nothing. We don't have the funds to be able to do that. It can't be nothing because if nothing would get done. The other thing that has to occur is from planning to design to operations, the processes need to be aligned. We're working really hard about that. Performance-driven decisions occur across the system. If planning is not done in a way that design can incorporate it such that the design can be operated to reduce fatal and serious crashes, we're going to have challenges. So think about the old design standard that required us to design for 10 miles above the operating speed of the system only leads to greater speed than the system. So we need to think about that. Incorporating context, not all systems basically operate the same way based solely on functional class. We need to think in terms of things in the multimodal sense. All road users are created equal in terms of their potential for fatal and serious injuries, as much as we should protect the vulnerable road users because they are vulnerable and susceptible to injury in a way that those in a vehicle may not be. Consistency in the way that we carry out and look at things is also very important. Next slide. So we set policies, procedures, and processes out. This is to incorporate and get the culture within DOT to focus on sustainable safety, in our particular case, how we were going to carry out the safe systems approach. Next slide. So safe system is a multimodal and multidisciplinary approach. You've heard this, and it'll be described in that way because that's the way that it's really carried out. If you think of it in terms of multimodal, but also all the disciplines working together, you're going to have a much better outcome overall. Next slide. So for us, we've been focusing really strongly on the issue of pedestrian safety and bicycle safety. And what I'm showing here is that we have an advisory council. The Pedestrian Safety Advisory Council was created in 2016, and it moved to, in 2019, what was called the Cooper-Jones Active Transportation Council. This council provides recommendations about how we should address what we should be doing to the legislature to help inform the safety professionals in Washington state. And it's been really active and quite good. Next slide. So you can see here right across the board, looking at safety principle number 1, speed, control, and separation, functional harmony. Things need to work together. Predictability and simplicity. On the road, people need to understand the road users, both those on bikes, those who are walking, and those in vehicles need to have predictable and simple systems to be able to operate in the most safe manner. Where there are mistakes, forgiveness and restrictiveness need to occur. Putting in access controls, an idea of restrictiveness. Forgiveness is putting in systems that should events occur, that they were reduced in terms of their severity. And to let people understand what they're doing. So we've heard a lot, and we're designing as much as we can self-enforcing types of systems. Right now, we're doing research, for instance, on why speeding episodes are occurring on our facilities using the naturalistic driving study. Next slide. We've also began to look at speed in terms of injury minimization. So speed management in the US is often addressing speed based on floating car 85th percentile. What we're trying to really get to is target speed. We're looking at category-based target speed, and Wes has highlighted some of that, and I think that Blair will do the same. We're making a recommendation that speed setting within 5 miles per hour of the operating speed, that we'll set it to the target speed. We'll go down below the 85th percentile is our recommendation. And where there are systems that are operating, we use iterative speed management to bring the system down in 5-mile increments. So again, the idea is to remove that potential for serious and fatality type injuries. Next slide. So for WASDOT, Sustainable Safety, Vision Zero, Safe Systems all offer the opportunity to strengthen the road to zero fatalities and serious injuries. We need to look at things in terms of data-driven and science-based. Make decisions based on information, not on emotion. We need to set up the systems to be able to do that great diagnostic and evaluation of the systems to be most effective in what we do. And we need to have the people, processes, and tools within our agency to be able to do that, and we're working hard. It takes time. This is a marathon. It's not a sprint, but I will encourage you to take a look at what you have. You probably already have good components of a safe system. And I'm sure from Minnesota and knowing the background of Minnesotans and what you've done in terms of your safety record, I'm sure you're well along the path. Next slide. So moving forward for us is next slide. Is WASDOT is looking at a complete change, our implementation plan. We've moved from crash prevention, systemic type of improvements. In the past, we were about 30% 70% reactive. We're now 70% proactive in the way that we fund our projects. We are funding where we have the greatest return on investment. And in Washington, we're also passing through about 70% of our HSIP funds to our local agencies, and about 30% is maintained by the state. The idea, again, is get the money to where the locations you're seeing the crashes, be proactive in doing so. Next slide. We're also discussing with our legislature and trying to do a comparative analysis to show them, if you look at congestion, the cost of congestion in Washington State, about $950 million. We spend $3.1 billion. If you look at state of good repair, $550 million, $3.6 billion societal costs. If you look at safety, $50 million in our program, $14.7 billion in terms of societal costs. Now, a lot of people don't like the idea of talking about that, but from a communication standpoint for us, this is really important for getting our legislature to understand at least the impacts as we see them. Next slide. I also wanted to show you how we've broken out our program. And it really, the cities have a focus on intersections because that's where they're seeing a lot of their crashes, as well as about 28% going to the pedestrian locations. Counties are really lane departure oriented. And for us, we're looking at forgiving roadsides. You can see that about 30% of our program, about 35% in vulnerable road users are really important for us. The other implementation is that we're doing within our crash reduction, most of those seem to be coming out as roundabouts now. We've also implemented what are compact roundabouts in our systemic safety. So we set about 15% of our fund to put in roundabouts. And so we're really focusing on that as an intersection solution. And we're really focusing on getting old hardware out of our system to reduce the potential for the fatals and serious. Next slide. So in summary, Target Zero is our guide. We use that, and our focus right now is on safe speeds. And we are implementing that. We're working with the cities in putting that together. And it's been a very good approach. It's going to be something new for us. We're also looking to align our programmatic approach, design, and operational practice to the safe system approach. We're pretty close and moving along quite quickly right now. Our marathon, we're in it, and we're in it for the long run. Our idea is for us to bring home our family and friends safely. So hopefully what we're doing will do that. We're all seeing challenges right now in the COVID system. We're seeing speeds going up, but let's do what we can. And Washington is there with Minnesota to bring home our family and friends. So with that, I'll go ahead and next slide. If you have any questions, you can contact me. I'd be more than happy to discuss with you. And thank you very much. And I'll give it back to you, Brian.
Thanks, John. We do have a few questions coming in, so I will hold those for the end. I just wanted to note that your slide about societal costs versus funding levels is absolutely striking. And I know, you mentioned sometimes people don't, really connect with that. And, in the end, a lot of us here are not involved in traffic safety because of, the costs of it. It's for the reasons that, you spoke about in the start of your presentation, and also the commissioner touched on. It's very personal. But I also think that slide kind of reinforces the fact and supports that government spending in safety does provide direct value back to the public. And I think that's important in ensuring that government is making the best use of public taxpayer dollars. So that gives us something to think about. Thanks, John.
Thank you.
So up next, we have Blair Turner. And Blair is a senior transport specialist at the Global Road Safety Facility at the World Bank. He's been involved in road safety for almost 25 years, first in New Zealand, then with the UK and Australia, and now in the US. In his previous role, he led research at the Australian Road Research Board on road safety engineering issues with a particular focus on implementing safe system infrastructure solutions. He developed a number of national Australian guides and contributed to various global road safety documents. He's a member of several international road safety committees and has been involved in a number of international road safety projects, most significantly as lead author and project manager for the World Road Association's Guide to Road Safety. He's also been actively involved in training for engineers and safety professionals from many countries, and has a focus on improving safety in low and middle income countries. With that, I will turn it over to Blair.
Thanks, Brian, for the introduction. And look, I'd also like to thank the audience for a great turnout today, and it's really encouraging to see such a strong interest in this really important topic. I am currently with the World Bank's Global Road Safety Facility, and my main focus these days is on low and middle income countries, based here in Washington, DC. But most of this presentation will be based on the experience I've had from that time in Australia. In Australia introduced the safe system approach more than 15 years ago, and we had a very steep learning curve, but a very slow learning curve as well. So hopefully some of the lessons from that experience will be of interest to you here in the US. So I just want to do a brief overview of the global perspective, and then I'll just touch on some of the issues I've seen in terms of progress already being made here in the US, and that really mirrors some observations from both Wes and John, that there's certainly a lot of activity now which is already relevant to safe system activity. But then I'll mostly touch on these international lessons, and this is, like I say, from Australia, but also from our European experience as well. So I'll touch on the need for a cultural shift, the absolute critical importance of tools, safe system tools, performance indicators and road safety metrics more broadly. And then I think there's a question in the Q&A about the research agenda and keeping up to date on that. So I'll touch on innovation and some of those issues that we needed to fill some gaps in knowledge in Australia. I'll show you those examples towards the end. So just firstly then, based on the global situation. So certainly the safe system approach has been adopted by many of the global organizations, the World Road Association, OECD, the World Bank, the other development banks, and the United Nations. And it's very significant. Just last month, this new UN General Assembly resolution really put it very clearly that member states are really encouraged to improve their road safety activities through promotion of the safe system approach. So this isn't something that's been developed in just one country in isolation. This is a worldwide approach, and it's certainly seen as the best practice approach. And if you look at that, if you recall that graphic that Wes showed earlier on the safety performance of different countries around the world, it's very notable that the top 5 or 6 countries and many of the top 10 are all embracing the safe systems approach. So look, just in terms of activities here in the US, and so I've been here quite a few times now over the years. Moved here at the end of last year and drove around a lot before COVID slowed us all down. But I do want to just restate what was said earlier, that a lot of what you're doing already is very relevant to the safe system approach. It's not a matter of starting over. It's really a matter of building upon what's already been done. And there's a lot more than just these 4 bullet points that you're doing very, very well. But these are some of the ones that really strike me as being some of the more important ones. So firstly, and I think John touched on this in his presentation very well, about, you've got this wealth of data that you can draw upon, and you do take an evidence-based approach in what you do, broadly speaking. And that's really important because many of the countries that I work in now, in low and middle income countries, don't have that luxury. And so a data-driven approach, evidence-based approach is already been undertaken, and that needs to happen more. John also touched on this proactive risk assessment-based approach. Crash data is vitally important, but there's also other approaches now being used globally and in the US, which are really proactive. It's not about chasing after where the last crash happened. It's about using that knowledge and predicting where the next one will happen. So if all those crashes happened at a high-speed bend on the road, let's go and address other locations that are similar before crashes start to happen there as well. So being proactive has already been done here as well. Probably the US is leading to some extent in this urban area, and I know Minneapolis, particularly this urban speed issue, trying to match the speeds with the function of the roads. And so it's not all about lower speeds, it's more about matching the appropriate speed to the function of the road. So where we have urban areas where there's vulnerable road users, putting in place those lower speed limits. Ideally those 20-mile-per-hour zones where there's lots of pedestrians and cyclists. Where we want to have faster speeds, put in place the facilities to allow safe travel at those higher speeds. So I think some great progress being made around the US in this area around matching the function of the road and speeds, but again, more to be done there. And then lastly, and I'll touch on this again towards the end, about transformational interventions. So, signs and line marking are really important, and we need to continue to use those approaches to benefit safety. But for long-term sustainable improvements in road safety, we need to do a lot more. And with the safe system approach, from Australia, we target the year 2050 to get around zero. It may not be necessarily zero, but it's close to that. So we've got a 30-year work program in front of us now, and with that sort of time frame, and with those budgets over that period, we can actually afford to do something quite substantial. And it's about using more of these highly successful interventions that almost eliminate death and serious injury. And we've already heard about roundabouts. These images actually I saw when I was in Minneapolis last year at a Federal Highways event. I think this is from Georgia actually, but they turned four-way stop sign rural or high-speed roads into roundabouts at very low cost. Built in a very short space of time, a lot of paint involved, so not necessarily high specification roundabouts, but they have almost the same benefit as a fully specified roundabout. So, and at 1/10 of the price. So they can afford to roll out these interventions quickly across a large part of the high-risk network. And that's really what's needed. And I guess encouragingly, it's starting to happen in the US, but we need to do more of that as well. So just very quickly, some of the things that need to change, and this is still the case in Australia. We had, like I said, 15 years of safe system. We spoke about it and debated about it for the first 10 years. And a lot of it was really theoretical and, trying to define things and trying to understand. And it's only really in the last 3 or 4 years we've really got to grips with what needs to be done. And I think from my experience there, a large part of this is really trying to quantify what we do. And one of those areas in which we can quantify activity is really around this cultural shift. And so if you can ask yourself in your organization, in your day-to-day job, where are you on different elements of the safe system approach? Those ones that Wes pointed out earlier. And I've just noted some of those down here. So things like blaming the driver, or do we take this shared responsibility approach? Are we focusing on all crashes, or have we shifted our focus to the serious and fatal crash outcomes? Are we moving to a proactive approach? Are we looking at individual pillars, or are we taking a systems approach? And just, you can reflect on these yourself in your day-to-day job, and you can use this sort of scale to understand where you are now. Are you 8 out of 10 in terms of the shared responsibility, or do you need to do more? And then you can come back over months and just see how you're progressing. Put in place a plan to understand where you are and what you need to do next to increase awareness amongst your colleagues on this sort of issue. So the cultural shift is needed. We need to understand these concepts and to start to change our activity based on those. But we can map that change through these sorts of reflections on what we're doing. The real change, though, I think, in Australia came when we started to develop tools. So like I said, we had this debate for 10 years. Everyone agreed that we were doing a safe system approach, but the reality was we were just talking about it. And so we had a project at that stage, which was to try and break this theoretical safe system down into more manageable elements. And one of those tools is the Safe System Assessment Framework. And this has actually also been now used in the US. There's an image of the guideline on the top right of the slide here, and you can Google Safe System Assessment Framework. But essentially, it broke the problem down into the key crash types that result in fatal and serious outcomes as columns, and then its rows, the risk causes, whether it's exposure, likelihood, and severity. So these will be very familiar terms to most people listening. And then in a qualitative way, we sat down and looked at our projects one by one and rated them. Were they influencing run-off-road crashes or head-on crashes? Were they changing the exposure, likelihood, or severity? How high was the likelihood that we would eliminate death and serious injury? And so from a half-hour process looking at projects, we could actually rate how closely aligned those projects were with safe system concepts. And then we could graph out that progress. So this shows in the black across these bars each of those key crash types, the rating of risk before any change was made. Then we had our standard designs that we'd normally use. And then we did the safe system assessment process with that light blue line. And you can see that we managed to change the risk substantially. And for this set of projects, there's about a dozen projects involved. We actually did that as part of the construction cost. There's no change to the cost of these projects, but we managed to embed safety at the outset, at that planning stage. So look, the key point on this, though, really is not how this works, what it's about. It's about the importance of tools that really help us understand the risks and quantify the risks and lead us towards a pathway for change. And then we can actually monitor and map that change. Another tool, and we've touched on this briefly as well, was a tool we use. It's an energy model tool for intersections. These are complex slides, and I'll try and just give you the basic summary. And that is for a very complex intersection, like on the left-hand slide here. Keeping in mind that in Australia, we're a bit funny, we drive on the left-hand side of the road. This tool maps out every single conflict point at, in this case, what is a signalised intersection. It's the intersection between a high-speed road and a moderate speed road, and that's in about 40 mile per hour and about 60 mile per hour. What the diagram on the right shows is we've done calculations for every single conflict point, looking at the likely impact speed and angle of impact. And there's calculations we can make based on the science about what's the chance of a death or serious injury occurring if a collision occurs at that conflict point. And this diagram on the right shows the outer ring, pretty much the chance is 100% chance of death or serious injury from this design for the large majority of conflict points. We then did the same calculation if this configuration was a roundabout, same speed environment. What would the chance of death and serious injury be based on, again, on that impact speed and angle of impact? And you can see here the red doesn't really exceed a 10% chance of death or serious injury in many cases. So these sorts of tools are really powerful to, one, understand the basic concepts of safe system design, but two, also as communication tools to show decision makers about why we need to move towards things like roundabouts and some of these other transformational road safety improvements. So a really key point, these tools to me were the major game changer for us in Australia. And as engineers, we use these tools commonly in our daily practice, and it's really something that we're used to using. We really struggle with theoretical guidelines that we're having to interpret ourselves. So a major recommendation is try to start to develop these tools. Another complex slide, sorry, this is from Sweden. Now, a traditional way to measure road safety is our final outcomes. We often look at progress in terms of reduction in fatal crash outcomes, or in some cases, fatal and serious. The more sophisticated approaches now break this problem down by the pillars of the safe system. And I've done that here in this diagram to show speed, behavioral issues, vehicles and roads. And it's about setting sub-level performance indicators, mapping where we are now, setting targets for where we want to be, and then monitoring our progress towards those targets. And so for roads, it's things like understanding what percentage of our travel right now is on roads that are, and I've got 80 kilometers per hour, so that's perhaps 50 miles per hour. What percentage of travel happens on roads at that speed where there is no median barrier? And here in Sweden, they started at 50%. They set a target of 75% for 2020, and this data was a little bit old. 2014, they were almost there. So it's about breaking the problems down into these manageable elements and tracking performance. So metrics is really, really important. Lastly, and probably of most interest, just very quickly now, given shortage of time, I'll just touch on this issue of innovation. We recognise that we need to do more of these transformational treatments. Obviously, large-scale networks. In Australia, we have thousands and thousands of kilometres of low-volume roads. So we needed to innovate and try different things away from our motorway networks particularly. And so some of the things we're doing, we scan internationally to see what's working elsewhere. And again, all these photos are driving on the left-hand side of the road. So in the top right image there, this is an intersection warning system, and this is in kilometres per hour. The normal speed on this road is 100 kilometres per hour, so 60 miles per hour. When a vehicle approaches from that side road, the speed limit reduces to 70 kilometres per hour, so perhaps 45 miles. And that has had a massive benefit in terms of crash savings because one, it lowers the speeds and there is good compliance. People see the risk on the road and they do slow down and comply. But number two, they're very alert as well. So a great benefit from that reasonably low cost intervention. Another major one for us is the left-hand slide there, wire rope barrier systems, both side of road and centre of road. Now this is our default position on our high volume networks. We've moved away from the thinking that the clear zone is the best approach, that a clear area to the side of the road will allow people to run off the road and recover and return back to the road. That just wasn't happening. We were getting massive issues of cars rolling over and people being killed. And so our analysis showed that the best result was these barrier systems that were flexible, and particularly these centre road barriers where that prevents the head-on crashes occurring, but also the run-off road crashes both to the left and to the right-hand side. So both of those interventions, about an 80% reduction in fatal and serious injuries from each. Left-hand image here, and we showed a version of this. This is a gateway treatment, and it's purely through signs and line marking. Narrowing the road down a few $1,000s with some paint and some large signs. And from a very small investment, we've got about a 40% reduction going from a high-speed rural environment to a township and maintain those speeds through those towns as well. Right-hand image here is perhaps a lower volume road where we can't afford to put in a median barrier, putting in place wide centerline treatments with audio tactile line markings, both center and edge of road. And sometimes we do this with a reduced speed limit if it's a low quality road. And again, some quite good benefits from a reasonably low cost intervention. Urban arterials, we're moving what we traditionally would do on our local roads onto our urban arterials. And this is really back to those discussions from the earlier presentations about the survivable speeds. So in terms of striking pedestrians, you need an environment of about 20 miles per hour. So in those areas where there's high pedestrian volumes, we're putting in place now these raised pedestrian crossings. At our intersections, we're putting in place raised platforms on the approach to these intersections. They're highly visible, the high risk locations, the public understands that, and they comply with those speeds, both because they see the risk, but also because of this platform in place. So we're doing a lot more of this and certainly getting those safety benefits from these interventions, starting at our highest risk locations first. Urban gateways, top right image there. So going from perhaps a more of an arterial road into a highly pedestrianised area. And that's a 30 km/h, so it's 20 mph zone, top slide. Variable speed limits, bottom left slide there. So as it gets to a busy period of the day, we lower the speed. In off-peak periods, we increase it back to the normal speed. Bottom right, a bit hard to tell what this one is, but we have a big issue in Australia. A lot of intoxicated pedestrians in some of our cities in the evenings. And so what we're doing more and more now is for the signals, this is off-peak period, not many cars, we turn the lights to red. And so when the car approaches the signals will change to green. But the effect has been that car has been slowed right down so that when that drunk pedestrian does step out onto the road, if a collision does occur, that'll result in serious bruising at low speed, but not death and serious injury. So again, some good benefits from that. So in summary, I'd just like to make some key points. Firstly, some great progress being made in the US. It's not all negative, it's about building on what we're doing, taking those good things and doing more of them. We do need to move away from the theory. We need to understand that theory, but start acting. And that's, to my mind, a lot of those issues I touched on were really about the need to measure. So set yourself some solid targets, break the problem down into elements so that we can track performance, we can allocate responsibility. We can even measure in a, I guess, a qualitative way or even quantitatively this cultural shift, both at the strategic level, so your understanding about the safe system principles, but particularly at project level. That was the game changer for us. And lastly, innovation is needed. The guides in Australia take about 10, 15 years for us to change new knowledge, and new knowledge is emerging every single day. So in a very controlled way, it can't be a random trial of a new technology or treatment, but in a structured way, following an evidence-based approach, we do need to innovate, try new things, and then scale up when we see the success of those interventions. So I would certainly encourage you to do that, but obviously in a coordinated way in discussion with state authorities. So I'd like to finish it there and pass back for Q&A. Thank you.
Thank you, Blair. You gave us a lot to chew on there. I appreciate the, safe systems is a philosophy, and it's an approach, and it's a perspective maybe that we use in doing our jobs day to day, but it's really helpful to see some of those examples of how it's played out in other areas. So I appreciate you sharing those, Blair. We do have a number of questions, and so I'm going to jump right in. And if it's okay, Wes, I'm going to direct this one to you. We had a question. Can you speak to the role of vehicle manufacturers in the safe systems approach? And they're referencing the recent increase in vehicle size being a factor in the increase in pedestrian fatalities. How do we get the vehicle manufacturers involved in this discussion?
That's a very good question. And you're getting to the points of kinetic energy, right? So if more of the vehicle fleet is composed of large SUVs with high bumpers, a lot of studies have recently shown that those are just much more deadly for pedestrians and bicyclists who are when they're struck, because it makes sense. It's a larger vehicle that has more weight. If it's traveling faster, it's going to cause more damage. As far as what's happening to address this problem within a safe system approach, I will note that David Harkey, who is the president of IIHS, has been working with the Road to Zero Coalition to pursue this concept of advancing technology and how to get automakers on board. And part of that is through the safety ratings that IIHS sets for different vehicles. and working with the different automakers to try to make sure that all of their vehicles are meeting that safety standard. But I will say it's more work needs to be done, right? I remember a presentation that David Harkey showed at, I think it was TRB this year, whenever we could all still meet in person, that showed one auto manufacturer offering a rebate of like $100 or $1,000 or something for every horsepower you purchase. And I was just blown away by that ad, because that's just saying, hey, you need more and more powerful vehicles. And I'm not sure that's really the case. We see the difference with, I think it was Volvo, they actually were talking about setting speed governors in their vehicles, recognizing that, hey, if you are able to go at a higher speed, you can cause more damage. And so we actually need, as manufacturers, to try to reel that in. So there is some movements, I guess, is my summary, but more work needs to be done.
Thanks, Wes. So we do have a number of questions. I know it's come up in all the presentations about the issue of speed, and it's a really hot topic in Minnesota right now. We do have a working group put together that's talking about what our vision for speed should be in Minnesota. It's getting a lot of attention across the world. We have bills proposed in the legislature, it seems, every year now along the topic of speed. So one question we had regarding speed, how does the speed issue or kind of severe injury crash related to speed issue in the US compare with Germany, specific to the Autobahn, where they don't have speed limits? So I don't know if, Blair, that's something you're familiar with, you might be able to respond to.
Yeah, sure. That comparison is often made, actually, that countries like Germany have no speed limit and they're okay. But the reality is quite different, though. We've done some comparative analysis of safety performance on autobahns. The European Transport Safety Commission did a really good study on this as well, and they showed that the safety performance is very, very poor on autobahns with no speed limit. There is actually an advisory speed on those roads of 130 kilometres per hour. And in fact, many sections now have been limited to that lower speed. So I think the higher speed certainly does increase the risk, including on those German autobahns. There's been a lot of studies globally about the actual impact of change in speed on crash outcomes, including on motorways type networks. And in fact, we had a situation in Australia where there was a demand for an increase in speed. Let's get the economy moving. And so the speeds went up from 100 to 110 kilometres per hour. And we saw about a 25% increase in crash outcomes from that move. And so almost immediately it was reversed, and they recognised that the risk was not acceptable, and the crash numbers reduced back to what they were before. So very, very direct evidence. And in terms of the evidence base, this is our strongest evidence we have in road safety, the relationship between speed and crash outcomes. And probably the most interesting fact amongst them all is very, very small changes in average speeds have a very profound impact on the more serious crash outcomes. So the numbers vary according to which study you read, but for every 1% change in speed, you get about a 4% change in fatal outcomes and perhaps a 3% in serious crash outcomes. But that works both ways. That works with an increase in speed, but also a decrease in speed. And so the positive story there is that we can manage to reduce our speeds even by small amounts. We get an absolutely massive benefit in terms of the more serious crash outcomes. And to get that same benefit from infrastructure improvements is very expensive. So it's certainly something that needs to be explored more. Thanks.
Thanks, Blair. We probably could talk about speed for hours, but I'm going to shift gears a little bit. Last week we had a session, and I'm not sure if any of the speakers have seen it, but we invited both Sweden and Norway to speak about their approaches to traffic safety, especially considering their success and where they sit across the world with their fatal rates. But one of the things that Sweden talked about was thinking about in terms of cost per fatality reduced. And I'm not sure that's something we've done a lot of here in Minnesota. I'm just curious, is that something that's more common across the world? And maybe directed to John, is that something Washington has done when number one, you're trying to prioritize the safety solutions that you can move forward with limited funds, but also tying it to the benefit you receive when you do invest in a specific solution.
So in Washington State, we have a specific requirement for benefit cost analysis as part of what we do in terms of prioritization of projects. I think it's a critical aspect, particularly if you're trying to have the most reliable outcomes in terms of crashes reduced, to understand essentially what you're doing from a benefit perspective is going to get you there. We fully implemented the highway safety manual, the crash modification factors approach, and we do monetize the benefits and the cost of the projects overall.
Thanks, John. I don't know, Wes or Blair, if you have anything more to add there.
Yeah, I can just add a little bit. Certainly globally, there are quite a few countries now moving to that sort of approach. I think the other thing I'd say is the World Bank is currently preparing a guide on funding for road safety that includes discussion on these sorts of issues. I think benefit cost ratio is still going to be an important part of the equation, but you need to think about what we're trying to achieve ultimately. And that is to reduce fatal and serious crash outcomes with our available budget. So I agree with the Swedish approach that we need to do those sorts of calculations about the cost per fatality saved or the cost per fatal and serious injury saved. But also you can do a BCR as well, benefit cost ratio. That tells you as a first step that this will be of a benefit. But then also you can use these other metrics as well to help you prioritize to get that end outcome, the most reduction in fatal and serious crashes from your budget.
Thanks, Blair. So we are at 2:28. I want to be respectful of everyone's time. I do have a few more items to go through here. And just a reminder, we will have this posted on our website. If you want to watch it again, who wouldn't? Or if you didn't get a chance to see all of it and you want to see the parts that you've missed, or if you have others you'd like to recommend that they view all the great information that was shared today. So just a few things, thank you to our speakers, of course, and to all the viewers out there. We hope you learned something new and will be able to share your knowledge with your colleagues. A link to an evaluation can be found in the chat box and will also be emailed to you. So please take a couple minutes to fill out the survey if you can. The TZD leadership team does read the results from these surveys, and it does help shape our future events. So please take some time for that. We do encourage you to follow the Minnesota TZD program on its social media. And we also hope you sign up for other webinars in our series. We strongly suggest you attend webinars outside of your E. And I think our session today had some good information along all of the E's. But we have other sessions that are a little more focused on an E, and it's typically helpful to get an understanding of what's going on in some of the other E areas. And of course, once you do, feel free to share that information with your colleagues, friends, and family. Next week, we have webinars on Monday and Wednesday instead of Tuesday and Thursday. And our topic next week for both sessions is child passenger safety. So it's not too late to register. You can register right up to the time of the event. And next week, we will have industry experts talking about the latest in child passenger safety products and injury prevention technology. A full listing of the webinar details can be found online. And remember, they are all free, but you do need to register. And so finally, I want to thank Wes, John, and Blair again for their insights regarding safe systems. And we want to thank you for taking the time to join us today. The Minnesota TZD program would like to end with this message. We know it's been a challenging year, and our work to reduce fatal and serious injury crashes may seem harder than ever right now. But know that together we're stronger. Together we can make a difference. Together we can make our roads safer for all users, and together we can get to zero. Have a great day, everyone, and we'll see you next week.